Okay, so welcome everyone. Thank you for joining us on the second of 7 series of webinars we're doing on an Innovator Toolkit series from Health Innovation Oxford and Thames Valley. This one, hopefully you're in the right place, is about developing digital products for healthcare. So we're going to go through a few bits and pieces there. Main structure is, well, I'll kind of say why a digital product for healthcare. Secondly, look at the regulation around that, a little bit more around information governance, hopefully understand what that's about. We'll then talk about evaluation of digital products, a little bit more about where your digital product is going to sit, who's going to use it, and lastly, kind of more information and resources. That's kind of the main agenda of what we're going to go through. So I'll just push through now. Here we go. So this is the second in a series of Innovator series webinars. You can see them there. We had one 2 weeks ago. Today's is developing digital products for healthcare, as you can see here. And then we've got a few more over the next few weeks. So if some of the terminology is hard to understand or process, in 2 weeks' time, I will go through all the NHS functions and terminology so you know what they are. I reference a few of them here in this one, but we'll have a bit more in-depth stuff in 2 weeks' time if you want to come back and see that one as well. We're then doing one around procurement, then around changing medtech regulatory landscape. A lot of that's going to be around CE marks, UKCA marks, other things around the world, trying to give you a little bit more of a deep dive into what that actually means. I referenced a bit of that today, just to warn you. And then a toolkit for NHS market access, so how you get into the NHS specifically, and a little bit more about developing NHS business cases specifically. Okay, so I'm going to introduce us. We are Health Innovation Oxford and Thames Valley. You can see a picture of some of our team from just a few months ago. So as I said, this is being recorded, but I'll do a quick intro just to who we are. I'm going to go through this pretty quickly. So if you joined us 2 weeks ago, you'll know some of this already. So we've been around for over 10 years, and we've been commissioned by NHS England, Office for Life Sciences predominantly. We help accelerate adoption and the spread of innovation. We're about improving outcomes, experience and patient safety, and about addressing health inequalities, and all about saving NHS money and also delivering economic growth and doing the right thing for all those people who are involved in that. So we serve about 3 million people in Buckinghamshire, Berkshire, Oxfordshire, Frimley and Milton Keynes in our region. We match high value innovations with identified population needs. We're about empowering NHS staff, and we focus on 4 clinical priorities, not exclusively, but mainly. We look at cardiovascular disease, maternity, neonatal, mental health, and respiratory disease as well. And we're part of a national network. So you might have known us as Academic Health Science Networks, which were set up in 2013. The name changed a few months ago to Health Innovation Networks, exactly the same organizations. And we've been relicensed until 2028 as these Health Innovation Networks. And this is us here, right smack in the middle of England. And this network covers all of England, but we do work with Scottish, Welsh and Northern Irish colleagues as well. And these are just some of the kind of key points that we've done over the last 10 years. So really kind of a decade of health innovation, big things that have made a big impact going forward. So that's the main introduction. So today we're going to talk about developing digital products for healthcare, which hopefully sounds straightforward. When you get into it, it can get pretty complicated. I'm going to try and keep it a little bit high level. There's a little bit of detail in there. If it gets too deep, I'll try and pull us out, but it's going to keep it high level just so you know the main bits you need to do for that. And as we go through all these pieces, okay? So first of all, why develop digital products for healthcare? Essentially, it's a win for innovators and it's a win for healthcare when done properly, of course. So what you see here is a quote and thing taken from Harvard Medical School. And they're really saying, you know, healthcare is complicated. We all know that. COVID-19, the global pandemic, really kind of accelerated a lot of digital tools because we couldn't see people in person. Remote consultations happened more. We relied on people having things like smartphones, other connected devices, doing more with that. Not to say everyone has it, but there's more of it there. And they estimate from their sources that last year in 2022, well, a year and a half ago, there was 139 billion US dollars, which is about 100 billion UK pounds in revenue generated just from the digital health market. And they're expecting by 2026, so just in a couple of years' time, that'll be about 3 times that. So 456.9 billion US dollars, which again is kind of high 300 billion pounds, I should say. And the last one there's from Deloitte, who do a lot of healthcare consulting around for lots of organizations. And they say 92% of healthcare professionals in institutes achieve better performance from digital transformation. Again, the caveat to that is doing the right digital transformations for the right reasons and getting it done correctly. And so we're all part of that. So first thing to define is, what is a digital product for healthcare? So I've gone through kind of 4 definitions here just to kind of make it clear, just so we're talking from the same kind of place. So NHS England, in their kind of their dictionary of this, they call a digital product a manufactured digital artifact, product or service used for health or social care purposes. This is quite a technical one, and they include it as a health IT system, a data flow, information standard, or a medical device. That's kind of helpful. It gives you kind of a little bit of idea. What maybe is more useful is to look at something called a digital health technology, or a DHT as it's abbreviated. At NICE, the National Institute for Health and Care Excellence, they say digital products are intended to benefit people or the wider health and social care system. And behind that, again, you got the NHS Innovation Service, of which NICE is a kind of founding and kind of contributing member. They define it as apps, software, artificial intelligence, digital platforms or services used for health or social care, and some digital healthcare technologies are considered to be medical devices. So again, we're getting a bit more detail into this. And the last one here I'm going to go into, there's links at the bottom so you can follow all the background behind these, is medical device. So not everything that's digital is a medical device, but some might be. And so this is kind of the bit to be aware of and not to fall foul of, or to be careful how you develop your product and service. So this is from Gov UK. The medical device, they define it as any apparatus, appliance, software, material or other article, whether used alone or in combination, intended by the manufacturer to be used by human beings for a medical purpose. For example, walking sticks, contact lenses, and breast implants, none of which are digital, but you get the idea. The idea is it has to help people in the health and social care area. That's why it's a healthcare one. And it has to be something that does something digitally and ideally in a medical way or a health related way. Hopefully that's helpful, maybe a bit too deep into kind of the detail. I'm going to quickly go through the next few slides because there's a lot of information, but there are links you kind of go through a bit more flowcharts for you. So the next one is the regulatory position. So this is how it's regulated by people who you need to kind of be aware of. So it might influence how you develop your product, or actually where it is now and what you're going to do with it. So basically, to be aware, is it a CE or UKCA marked device or product, and is it done appropriately? This all depends on what it is itself, and also what claims you as the innovator make it that it has. So if you claim it's got medical-like qualities, you have to be able to defend that with evidence and demonstrate it does that, essentially. CE marking is the European model. It works for the EU. As you know, we were in that until Brexit and we came out. We've created UKCA marking. It's the UK equivalent. And for the time being, we're still recognizing CE marks, just because the government hasn't figured out exactly how to phase those out to kind of be compliant with EU work as well. The main thing to be aware of is it's up to the manufacturer or whoever makes it or distributes the product to be aware of the applicable directives and standards that apply. Get the documentation right, make sure it's regularly reviewed, and it's all ticking the boxes everywhere along. I'll explain more. This thing here you see in this kind of guidance, this is from the Medicines and Healthcare Products Regulatory Agency. It's kind of an interactive PDF. There's a link at the bottom there. It walks you through whether it is or whether it isn't. Lots of details. I'm not going to go into the detail of that, but it's available as a link. You can follow that later just to see. I'm going a bit more into the attributes of a medical device. So again, like I said, it's what its purpose is as stated or claimed to be. So if you don't say it doesn't have any health benefits or does not a medical device, that's absolutely fine. So it doesn't matter. But if you've got some of these specific medical purposes, then you may be a medical device. Just be aware. So if you're doing diagnosis, prevention, monitoring, treatment, alleviation of injury, of disease, if you're starting, replacing, modifying some kind of a bit of the anatomy, supporting or sustaining life, controlling conception, disinfection of medical devices, or providing information from in vitro examination of specimens, blood samples, things like that. And it doesn't achieve it mainly by pharmacological, immunological, and metabolic means, so medicines, things like that, then it might be a medical device. So just be careful. If you don't want it to be a medical device, just make sure you design it and promote it as such. If you do want to be a medical device, make sure you follow the rules and you stay within those. Some international standards out there as well. We're mainly talking about the UK because we're for the NHS, but there's more harmonization around the world around what those standards are. A few of them are referenced here. The main thing is they're looking to make sure things are safe, effective, and they continue to do so throughout their service life. So it's not just now, but as they're used and come out, they'll still be like that. And the EU, UK, and US and other regulatory processes will differ slightly, even though there's harmonization of the ISOs and other things like that. So you really kind of need to know what you're doing in different markets. Again, you might want to choose specific markets to start off in, or kind of do parallel things all the way through. There's a link there, again, a bit more detail, which I won't go into right now, from the International Medical Device Regulators Forum about their strategic plan around harmonization, just to make it easier for innovators to access different markets without having to jump through lots of hoops, is what they're getting at. Okay, hope that's a bit helpful, very detailed. Apologize about that, but it's kind of necessary if you understand that. Do a bit more research or get some organization to look for you if you're not confident doing that or just want some help. So I'm going to get back into the definitions of what digital health technologies are. That's mainly the digital products we talk about. It could be other ones as well. So here's one from NICE when they look at their kind of evidence standards framework for digital technologies and products. They say that digital health technologies are products intended to benefit people or the wider health and social care system. We've heard that before. So smartphone apps, most people are familiar with those now. Standalone software, so software that doesn't interact with other things like a phone. It could be some on a computer or other thing. It could be an online tool for treating or diagnosing conditions, preventing ill health, or it could be a program used to analyze data. So it's taking things from a machine and doing something with it. And they've got 3 tiers of kind of risk behind that. These are nice tiers. These aren't the medical device ones. Tier A is kind of the lowest risk, and I put that thing on the right. So this is my addition here. So the lower the risk, the less regulation behind it. Essentially, you can self-assess for some of these. So health technology is intended to save cost or release staff time, doesn't have a direct patient health or care outcome. So essentially, maybe a timesheet tool, something around kind of training people better, things like that. The next tier is kind of stepping up a little bit, is really about for helping citizens and patients manage their own health and wellness. If you think about going to the NHS app or going to any of the kind of online repositories of information where you kind of do a diagnosis or symptoms search, that'd be that. So communicating about health and care diaries. So people just writing things down with no transactional element to it, going to a clinician, just logging information, or promoting good health, kind of general well-being things. These are kind of a little bit more risky, but not too highly risky. And the top one is really the tier C. So these are ones that are really technologies for treating and diagnosing medical conditions or guiding care choices. So really, really helping, really kind of doing more of the healthcare itself. So these would be things with direct health outcomes. They're likely to be regulatory medical devices in this category. And that could be informing clinical management. So helping a doctor, a nurse, physio, pharmacist, someone make a decision, kind of how do I balance the information in front of me, to drive clinical management. So that could be how you triage or how you kind of prioritize what you're going to do. Treating a specific condition. You've probably seen things that maybe monitor diabetic patients and their kind of levels of insulin. Those could help them kind of do that, monitor that. Or maybe to diagnose something. So using this technology to diagnose someone with a condition that might need management. So you can see how that gets, it's going to be a bit more risky, and therefore it's going to be a bit more management around that. So the thing to be aware of when you create your innovation, your digital technology product, so something to be aware of. So the digital technology assessment criteria for health and social care, DTAC it's called internally. That's not really their logo, but it's kind of just an image in the top right. If you are not aware of that, do look at that link below and check it out. But the main things to be aware of is it's designed by NHSX, which is now part of the NHS England Transformation Directorate. And it was designed to be used by healthcare organizations to really assess suppliers, so innovators coming to them with solutions at the point of procurement or as part of a due diligence process to make sure that digital technologies meet the minimum baseline standards. It just means it's minimum. It doesn't mean it's perfect. It just means it's safe enough. And for developers, it sets out what's expected by the NHS and social care for something to be in place. It's not legally required, but it's highly essential and recommended for all people buying stuff to check the DTAC status. And it focuses on 5 core areas. I'm not going to go into the detail of them. They should be fairly self-explanatory. Again, follow the link to get more detail. So the 5 core areas are clinical safety, data protection, technical assurance, interoperability, usability, and accessibility. And you'll need a CE or UKCA mark if your product requires it to pass DTAC. That's going to be one of the questions they'll ask, so do expect that one to come through, okay? And there are 2 clinical risk management standards, and it's quite technical. So established in the law through Health and Social Care Act 2012. I reference them here. Again, follow them for more information. what they're looking at is DCB 0129 and DCB 0160. They look very similar, but if you look at them, one is around how it's manufactured, so how it's produced. So it's application and manufacture of health IT systems. So clinical risk management, so how it's done, what you're doing and stuff in there. And it talks about having a clinical safety officer. This person is responsible for making sure you address those requirements. The second one is how you deploy it. So one's how you make it, and one's how you deploy it, how it gets out there to patients, to clinicians, to people using it. And that requires health organizations to establish a framework with clinical risk associated around that. And both of these are embedded in the DTAC assessment documentation. It would take many hours to go through all the bits of DTAC. You can go on there. There's a template they'll walk you through things you'd expect around how you deal with data. Have you got cyber essentials or other kind of things to make sure you're secure? Lots of detail in there. So that's kind of what's expected from NHS procurers or purchasers or users of any kind of innovation coming out there. Other things to be aware of, whether you're going to the NHS or straight to customers to be aware of, are coming up. So first one you should be aware of, hopefully, is UK GDPR, General Data Protection Regulations. So these came from the EU, and the UK embedded those with the Data Protection Act in 2018, which I'll go into a bit. So this is something you need to do as any business. So whether or not you're a technology business or not, but particularly if you're dealing with technology and data, you have to go through the 7 key principles: lawfulness, fairness and transparency, purpose limitation, data minimization, accuracy, storage limitations, integrity and confidentiality, accountability. All things make sense. The big thing is getting those, like, data, people's personal information needs to be held secure. You're getting that message through, hopefully. And those principles lie at the heart of the approach to processing that data. So you ask people's names, dates of birth, height, other medical information. Expect you have to demonstrate how you're processing that, and it's done securely, safely, and for the right reasons. I reference another bit, Data Protection Act 2018, and that's how personal information is used by any organization, business or the government, and it's really the UK's implementation of the GDPR regulations. So we put that in before we left the EU. So that's probably one of the great harmonizations with the EU kind of standards as well. And everyone responsible for using data has to follow the strict rules. Again, similar to what you just heard before. So when we're in the NHS, we have to do annual training around kind of information governance, and we have to go through all of these, make sure we're not using more information than we need, we're storing it appropriately, it's secure, everything you'd expect to happen if you were a patient and how you'd want your information treated. Expect as an innovation, if someone creating an innovation, you have to do the same again and be able to demonstrate it all the way through. Now, this is getting even more into the kind of in the weeds here. So when you've got these data protection kind of aspects, there's something called a data protection impact assessment, like a risk assessment for data. This is taken from the Oxford University Hospital's guidance around that. Essentially, when should a DPIA, when's it required? So if personal data is being processed, so anything done to it, so it's being stored, it's being manipulated, it's being analyzed for a new system or product, for a new supplier or service, as part of a new data sharing agreement, involving a new use for the existing data, involving a new change. So lots and lots of times. And there's a whole long list of DPIAs that the OUH already has. And it's not covered by a previous one, and it's likely to result in a high risk to rights and freedoms of individual, high risk processing. I'll go into that in a second. It's not clear. If you're not clear, still do it as well. Lots of reasons in there. The thing to be really clear on, if you look here, it's this bit around here. So examples of high risk processing activities. So automatically considered high risk, just by the nature of what they are. So use of technology, so AI. You can imagine how AI would apply to that. Machine learning, deep learning. So by the fact that these things are kind of those technologies, they're going to be in there as well. Automated decision making. So anything that's automated, so a human isn't touching it, it's making a decision on its own, might be eligible for that stuff. Profiling of individuals on a large scale. You're looking at a whole population of like millions or thousands of hundreds of people, expect it to have to meet these as well. Biometric data, so things that are specific to people, so faces, voices, fingerprints recognition, anything around their genetic or health or other personal data, those are going to sit in there. And the DPIA is designed to help you analyze, identify, and minimize those risks. And it's a key part of your accountability obligations under UK GDPR, but also if you expect that to go to patients directly or through NHS organizations, expect they'll want to know how you do that. That's why I've referenced it here. Okay, so the OUH guidance, there's just a bit more of this and then we'll move on to the next bits, is around kind of DPIA. So it's undertaken when all the things I just mentioned there. The DPO is the data protection officer. They'll review it and advise whether it can go ahead, and they will decide if the ICO, the Information Commissioner's Office, needs to be consulted with. So they deal with it everything on a national basis. They give advice and they'll review it regularly. So more high risk, the more they'll want to review it, as you'd expect. So you need to make changes possibly. They might say, maybe do something slightly different just to be safe. Okay, so that's kind of the regulatory, all the safety bits and pieces. Another thing I wanted to reference was something called a data sharing agreement. If what your innovation does is it takes a lot of data from any source, from UK, from NHS, from an individual practice, GP practice, let's say, or a trust or something like that, you need to get a data sharing agreement between the parties sending and receiving data to make sure you're complying with the accountability thing. It's not mandatory, but it's probably going to be really, really well received and shows that you're doing the right thing around it. You might call it something like an information sharing agreement, a data sharing protocol, or a personal information sharing agreement. It doesn't matter. It's good practice to have that in place, to understand what you're moving, how you're moving, and what you're doing with it. And it's also going to help you show you're doing UK GDPR, Data Protection Act, and other elements as well. So it's a bit scary, but obviously if you've done it before, you probably know about that. You might want to get more kind of specific information if you're kind of struggling with that. We can help a little bit. We can also signpost you to the right people in government who can help you too. Okay, so that's kind of the regulatory bit, which sounds big and scary. I just wanted to make you sure you're aware of that. So once you've created something, which is an innovation that's digital, what you need to demonstrate is you can evaluate it. So, and this is kind of taken straight from the Evaluating Digital Health Products guide. So evaluation is finding out what works and what does not work and why. And it involves collecting data, enabling you to assess the effectiveness of your product. Now I'm going to put another caveat in here again. Just because technically it works in a lab on a computer, it may not work when it hits the real world for a number of reasons. And that could be things you don't foresee. People do strange things sometimes. They interact with things strangely. Sometimes they get confused. All sorts of things that may be beyond your control. So what this is about is really just making sure that it's safe and effective. And again, looking at these challenges. So they've mentioned these challenges. So non-digital healthcare products, like medicines and syringes, things like that, you'd expect them to be tested regularly, evaluated to be safe and everything else. So digital products should be evaluated too for the same reasons. They got different challenges, so they change a lot. So if you ever had something that changes and updates itself continuously, like MS Teams, for example, it changes itself rapidly. So it can be hard to figure out whether what you've assessed as is still the same product you're looking at. So you need to be careful of that. Digital moves more quickly. You're not going through a big controlled manufacturing process to do that stuff. Most digital health products are complex, so they don't sit in isolation. They're interacting with other elements back and forth that have different functionalities, different features. Evaluations may focus on certain things, so the minimum set, maybe more stuff you need to do, or it might grow. And lastly, the regulatory framework for digital health products is evolving. So we're understanding more about AI, about how the internet works, how things on a smartphone or on a computer or another kind of device may influence these things. So that's going to change how we do that. That's why things have to be reviewed regularly. And you need to keep really good documentation to demonstrate how you're doing that. Okay, and this is I should say this is something that Health Innovation Oxford in Thames Valley does a lot of. We do lots of evaluations with digital health products with lots of partners, with NHS partners, with innovators externally, with everyone to make sure that they're doing what people think they're doing and doing it right and giving kind of an independent view to that. So when you're looking about digital health products, if you think about it, though, digital devices access is not ubiquitous. Although it seems like everyone has a smartphone, not everyone does, or maybe not everyone wants to use it for health purposes. So you can see there's more stuff in a smartphone. So whereas now you can have a smart watch or smartphone, they can do different things. They can measure your heart rate. They can do all sorts of stuff. You need to be careful. You're going to try and apply that as a medical device. You need to make sure it's going to jump through the right hoops and can demonstrate that. Maybe you can. That's great. The other thing to be aware of is there's a big difference between a health product and a well-being app or tool. So well-being is kind of just, good advice, sleep more, things like that. Whereas a health one might say, I'm going to measure how much you're sleeping or measure key biometric aspects of your sleep and then give advice or get a clinician to look at that stuff. So you need to be careful around that from the regulatory position and also how the NHS might use it if you want them as a customer. You'll still need to demonstrate your value proposition for your technology. As we covered 2 weeks ago, I'll go through a little bit of that, but essentially why whatever you've got is useful for whatever purpose you're proposing it to do. And main regulators like the FDA, Food and Drug Administration in the US, and the NHS in the UK, they're working to evaluate lots of these mobile health applications because they're coming in the market rapidly, and sometimes it's hard to keep on top of it, which is why there's different programs coming in to look at those from NICE, from MHRA, and other places. And to relate those, you need real world-time data. So things might change. So with COVID-19, we saw that really quickly. People started using things differently than they did before because they couldn't get out of the house. There were different conditions. People were now more comfortable doing self-tests and things like that, which they may not have been comfortable with before. There's rapid cycles. So we need to make sure that's there. So if you want to do that, there's a link here again to another UK government guide. Yeah, the slides will come out, and they're all the PDFs as well. So 7 steps about getting started, defining how your product works, designing an evaluation, so choosing one of the methods. There are multiple out there, carrying out the evaluation, analyzing the data, and using your results. You can do that yourself. Most people will work with a partner to do that, and we are one of those partners. There are other organizations that do that as well, but if you want an evaluation, you can fund it yourself, or you can get it funded through a grant funded application as well. So UKRI, UK Research in Innovation, has got lots of different programs which we work with as a co-applicant to help people go through those. A quick example is a real-life example of feasibility studies, and doing that is Euphonia. It's a company we've worked with over the last few years. This is just a quick download of what they've got on the kind of the database from the government. So back in 2018, 2019, they came up with an autonomous speech-based clinical outcome measure, and they got some money, a little bit of money, so £60,000 or so. They then followed that up with another one to monitor and deliver virtual clinics, which about £666,000. Some of it's match funding. They expect the Innovator to put some money in as well. This is government money from a grant that they've applied for, and we've worked with them on to do. Another one looking at remote cancer, again for the same technology. And the last one from 2020 to 2021 about automated telephone calls to triage and reassure patients at home. So Euphonia, if you look there at the top right, that's their logo, but you can see they've got Cyber Essentials Plus, the Crown Commercial Service Supplier. So they're on a framework, people can buy them easily. They've got a CE mark and they've got a UKCA mark. They've gone through all the hoops, they've demonstrated all that. So they're ready for someone to purchase them. And they're doing lots of stuff around follow-ups for people with cataract surgery, where it used to be a nurse or someone else phoning them. And now this automated voice will phone them up, ask them questions. And if they all fine, it'll just record that. If not, they'll get a clinician to contact them. And you can think how much time that's going to save and how that helps work that workflow and reduce those kind of backlogs and things going through. Okay, and that's so there's a link at the bottom there. You can see kind of our case study of how we've worked with them over the last few years. And they're out of Oxfordshire and Buckinghamshire area, so they're a local company as well. Okay, so next things to think about is really kind of where and by whom will your digital product be used. So often we think about digital things, we think about an app, and then we're thinking kind of here. It's patients, end users. So in that case, you may not have to go through an NHS body at all. You go straight to patients, so direct to customers. But if you look at it, this is kind of what I was talking about, the structure of the NHS and pretty much most health systems. So primary care, what most people associate with the NHS, GPs, general practice. So their doctor, they know them, they trust them, they want them to help and find their way through the health things. Dentists, eye care, community pharmacies, all in the primary care aspect. And then you can move up a level, you kind of to kind of more specific care. You got secondary care, planned elective care, urgent emergency care, mental health care. These are what we generally think of as hospitals, district general hospitals, larger hospitals, others like that. They don't have to be hospitals in every instance. Then community health, district nursing, health visiting, child health services, sexual health services, all things that are managed in the community. Again, they might come to the patient or they might be accessible to the patient outside of a big hospital setting. Sometimes it can be in a hospital as well. And the last one, tertiary care. So really kind of higher level specialized services like neurosurgery, transplants, plastic surgery, secure forensic mental health services, really high end stuff. That's kind of the way the healthcare is delivered in different parts. And most of what we've talked about there actually sits over here in this kind of pyramid, care providers, health and social care. So this is what most people associate with the NHS. This bit down here where the actual delivery of healthcare, the doctors, the nurses, the physiotherapists, the pharmacists, everyone working together around a patient. But the way that's organized currently in England is around integrated care systems. So ICSs are integrated care boards, ICBs. There are 42 of them in England at the moment, as of, I think it's 2022. That came out, they were formerly clinical commissioning groups and sustainability and transformation partnerships. And before that, it was other things, but these are kind of the organizers of all that care going on. And above that, for digital products, you need to be aware that NHS Digital, which is now part of NHS England's Transformation Directorate, sits above that, which is NHS England. NHS England is part of Department of Health and Social Care, which is kind of managed by the Health Secretary and by UK government for all the benefit of everyone else. You can see it gets smaller and the money trickles down, up and down through all that. So The reason I put this up here is for you to think where your product is going to sit, because it's not always clear. You might say this is a product for X patient. That makes sense, but is the patient going to buy it? Is it going to be bought by and used by a GP practice? Or if they're not going to buy it, is it NHS England buys it? So we can help you work through who that customer is, so the purchaser as opposed to the user. That's really important for health markets to understand who the payer is and who's the purchaser. They're slightly different, and the end user, they're slightly different sometimes. Okay, so I'm going to go through, hopefully not too technical, just kind of some background stuff. If you're all technical people, you know this stuff already probably. This is kind of an ecosystem of a healthcare IT system as opposed to a more generic one. So they took a look at kind of 3 different points, so things here. So one, point of care applications. So these are things that a healthcare worker would use in a hospital or in a GP practice. So in a GP practice, when you're having your notes pulled up by the GP or by the nurse, they're looking at something like EMIS or System 1. These are systems that give them the relevant information. It's electronic patient record. They're storing the information. They're doing transactions of messages and information, getting details on blood tests or other notes and things back and forth. They can order things through that. And it's generally tailored to a very specific use, and it can be local, regional, or national in scope. Some of these are very specific just to a certain site, other things as well. The other one you can look at is a patient-facing application. So these are things that patients themselves are using. So if you use the NHS app, or you've gone through an e-referral service and you get to choose and see the progress of your referral, that's what a patient is using. And again, that can be local or national or regional. This is where they're sitting in here. Sitting behind all of those, as you'd expect, are back-end applications. So these are accessed by other applications through APIs. They're not directly by end users. So all of these go through back here. It's generally nationally in scope, so monitored, really highly regulated, and it often includes a database. So really big databases, not your simple thing you might have done in school, really big kind of ones on kind of global standards, and they enable integration between care providers. So when a GP or a dentist talks to a hospital or talks to a patient, sends that information back and forth, they're going through these back-end applications all the way through. I'm not going to go through every bit of detail here. It's just kind of high-end. If you don't know already, it's kind of background. Another thing to be aware of that sits behind it, one of these back-end systems is the spine or the national spine. So when people refer to this is kind of what kind of helps everything going, keeps it going. It's an umbrella term for the collection of national applications. So all these ones over here. Some have a few acronyms. I wouldn't worry about it too much. So the analogy is it's the backbone of the health tech, care tech in the NHS England. So you need that to kind of build everything else off of. And the applications are things like personal demographic service and summary care record, things that you can get quick information about a patient really quickly with an NHS number or another detail as well. It should be secured with a smart card, so only the right people can access it with the right controls. A DOS, so showing what services are available, things like that. All these different pieces. So depending what your technology is, you may have to interact with some of these through the right way. And I'll kind of get into a bit more of that. Again, a bit more technical, hopefully not too technical, just high level stuff. So APIs or APIs, application programming interfaces for integration interoperability. So essentially how you send information securely around places. There's a little diagram here. So a system requests some patient data in the right way. System B says, yep, I've got that, and sends it back. So it allows that system to keep progressing it. It can be all sorts of things like, here's an NHS number, give me the patient's name or age or date of birth and other so I can confirm that, or tell me when their last appointment was, when their appointment's coming up, things like that can happen there. So if you've used anything with your GP where you've got an app and you're checking your appointments or your prescriptions, that's there. Or same thing with a pharmacy. They might get something from the GP saying, please prescribe this to a patient. They go, thanks, I've got it. I'm prescribing to the patient. It's been issued, that kind of stuff. Back and forth, just transactional stuff in a secure environment. And there are international and national bodies and standards for all of these. Some of them apply so to all APIs in general. So healthcare in the UK uses FHIR UK Core, which is essentially like the international one, which is FHIR Fast Healthcare Interoperability Resources, or HL7 version 3. And these are standards for use around England, Scotland, and Wales, and Northern Ireland. And there's very specific healthcare use cases as well, so it's clinical decision support or end of life. There's a lot of data flying around. So it's got to be done in sort of a standardized way. That's what that's there for, and that's about. So the way that people can access information where it's stored is, so as you'd expect when you access anything on the internet these days, it's probably in the cloud. This is part of a government policy back in 2013 for cloud connectivity to the health and social care network. So if people are in the NHS before, you might have heard of N3, the health and social care network is the new version of that. So it's a secure and very well controlled network to share that information. There's a diagram from these sites here. So the cloud service is also endorsed in the personalized health and social Health and Care 2020 framework as well. The idea is that essentially you've got your so Microsoft Azure, Amazon Web Services, and Google. You can store information there in a secure way. They keep updating that, making sure it's safe. It's secured. Health and Social Care Network sits here. These are on the internet. Different organizations can send, receive information back and forth. Maybe you have a local peer network here, but essentially it goes back to the internet. And the reason for that, as you might expect, is kind of like everything else in the world these days. Internet first was part of that rather than closed private networks. So although a health system or something could sit on its own in one small network, that would be only as useful as that small network. If you put it on the internet, they can suddenly start talking to many more organizations, but you need to make sure it's done securely and safely. And that's part of that standard set out. That internet first policy, and it's all around kind of reviewing that and making sure it's done safely all the way through. Okay, so there's a lot of things to think about in that. So I mean, the NHS is trying to structure it in a way that it can be done safely, effectively, securely, using just the information it needs and not more, but also providing a framework and kind of a structure on which innovators can place their products as well and really take it somewhere. That's really the point behind it. And going back again to what we talked about 2 weeks ago, if you were here, was really looking at what's the value proposition. So the value proposition, really think about for your technology, go back to the last webinar if you want to see the video or the slides, to look at kind of these 3 levels of what it's doing. So for the patient, for the person who receives the care at the end of the day, how is this going to make it better for them? So how's it directed at them? What kind of patients? What disease is it helping them with? Is it a diabetic patient? Is it a patient with COPD? Is it a patient with anxiety or depression? How does it progress? How does it, how does it help them with that stuff? How does it compare with other things? For the service here being the department, the team that's going to be using this in any way, either from the patient directly, they're getting information, or they give it to a patient, or they use it for a patient. So how's it come about? How are they going to use it? How are they going to deploy it? All those kind of things. And then nationally, how does it fit into the national kind of framework or strategy around either management of that condition or management of those services and everything else? And really go through all of how these things might impact them. This is kind of a very detailed way of thinking about it. But think, am I solving a problem that really exists at the moment, or is it so innovative there's no problem identified yet that's really going to be going forward and helping them to solve that? So we talk about pains and gains. So what is the pain that either a patient has or a service, so a clinician has, and how are you solving that? A lot of them could be around helping getting better documentation or going through large sets of data and helping to prioritize things. And as you can see, if your technology is going to work autonomously on its own, it's going to be very high risk. So it has to be demonstrated it's really effective and safe, kind of like a self-driving car. Before you let it out on the road without anybody in it or anyone driving, you make it sure it's really safe. The same thing with these technologies, with the AIs. We need to know what it's doing and if it's really helpful. So what most people do is have it be a clinical decision support tool. It will advise and say to a regulated clinician, someone who's qualified as a doctor, a nurse, or a pharmacist, here's some things we might prioritize. We think you might want to look at these, and then use your clinical information and knowledge to then make that decision going forward. That's the next step. So that's really kind of how you might want to place it. So you can be really careful with your technology, whether you're going to say you're going to do everything, or whether it's really just there to help support them and do that stuff. Okay, so I've raced through quite a lot of stuff. I'll just go a bit more here. So a summary of kind of what we've gone through today. I know there's a lot of information in there. You will get the PDF slides out later. You'll see that with all the links, get more information. There's much more information behind all that. So the first thing to think about is, do you have a digital product? So does it meet those definitions? So if it's not digital, if it's just a well-being thing, maybe you don't have to go through so many regulations. You can just put it on the App Store or Google Play Store and it's available. So first, confirm if the innovation meets the NHS definition of a digital health technology. If it does, then think what regulatory requirements exist for this. So is it a medical device? So if it is, it's going to have to meet certain criteria. If not, maybe you don't have to worry so much. Can you meet or demonstrate compliance with those relevant international and national standards? Like I said, there's DTAC, there's clinical risk management, information governance, all that data stuff. Data is really hot. You have to be really careful around it. Make sure you're managing it appropriately. That's drummed into everybody in the NHS regularly and consistently. Nobody wants their data being shared inappropriately, but they do want their data used for helping them kind of manage health conditions going forward. And then evaluation. So a lot of what we do, and lots of other organizations do as well, NICE as people. So looking at how do you evaluate that? So the value proposition for this technology. So the kind of so what? So you've said that this does something, but Does that make a difference for health? Does it make patients healthier? Does it make the health service more efficient or more effective? They're going to want evidence and proof of that, not just in a kind of lab setting, but in a real world setting. And again, we do a lot of that stuff as well, helping develop that thing. And where and how will it work? So not just does it work, in a controlled environment, but where's it going to be placed? Is it in primary care? Is it with the patient directly? Is it within a hospital? Is it going to be kind of a national system we expect? Is it around screening, calling the right people in to have tests? Is it about giving results back to people? Is it about helping them jump queues or figure out how long a queue is before they get into one at hospital or before they go in for treatment or service? And the main guidance that we're getting nationally is, so it's yes to the above, pretty much any of those, then register with the relevant bodies to get started. So it might be MHRA, it might be NICE, it might be National Institutes for Health Research, who do all the kind of clinical trial work. Obviously, Health Innovation Networks, us and the 14 other of us around England. But the main starting point for all of that, we're told, and it's the NHS Innovation Service. That's a new national service, which is innovation.nhs.uk. There's a link later on, don't worry. That's got lots and lots of information and guidance. They ask you to fill in long form, but that is your kind of way to get into NICE, MHRA, the AI and technical guidance kind of people as well. They will ask you to fill in that before they engage with you. And it's all then on a controlled portal. You can see the progress and who's been assigned to all the way through. Okay. So if you want to get help with your digital health technology, obviously we're here to help and give some initial guidance. We can have initial kind of calls with you and talk things through with you. We can help kind of look at different bits and pieces of real world evaluations. We can partner on grant funding applications with co-applicants. We can help you do data collection, report writing, health economic analysis, and links with local health organizations to see really are you in the right area for what you're proposing. We do lots of that stuff. And as you expect from lots of links coming out, there are a lot of websites. These are just a few of them. So, there's the government website, there is the NHS Innovation Service, that one in the middle, and understanding regulations on that. And there's NHS Digital, who've got lots of guidance around those different bits and pieces there as well. And there's a long list of additional resources here. So there's a lot here. So I won't go through all of them, but there's Innovation Service, there's NICE, AI and Digital Regulation Service, there's ORCA, who are really good, the Organization for Review of Care and Health Apps. They've got a really good library of kind of effective apps. So they don't just say, here's an app, they actually go through and test it. They've also got a lovely link there about the digital kind of health product assessment frameworks, not just for the UK, but also for Europe, the US, and other countries around the world. Really helpful, useful stuff to help you understand that. For lots of organizations who will help you get through DTAC, help you make sure you got your data stuff in place. Depending what stage you are, you might want to work with them. Medical device information, if you think you might be a medical device, the first one is that PDF, which is interactive. You click, yes, no, like a flow chart. Really helpful. There's our information here, our webinars for a range of different stuff that you might look at. Another one to mention is the MedTech Early Technical Assessment Tool, META tool by NICE. Big kind of caveat here is, not a caveat, to be aware that there's a fee for that. So it's a minimum of £7,000 plus VAT per product for them to do that. And if you do it through NICE, they will identify gaps in what you have against what an NHS commissioner or user would like to have going forward. Okay. And then the other one is the NICE Early Value Assessment for MedTech information. That information is there in place to really look at things that potentially could be really innovative, really demonstrating great value for the NHS and everybody else. And they will go through that, and they've got a whole series of them they want us to work with, but you can apply to that as well if you think what you've got is really innovative and beneficial. And the last one, I suggest you look at this if you haven't looked at, or you need to update and refresh yourself, is the Information Commissioner's Office information, really around GDPR, all the other kind of data things you need to be aware of. Okay. So that's kind of the resources. I'm going to highlight, here's the other innovations coming up. So it's going to be terminology, procurement, and then medtech again, just without digital, just medtech, then NHS market access, and then developing NHS business cases over the next few weeks. So sign up for them.